also the president of United in Peace, Inc. We got a very interesting show as a follow-up to last week's show, dealing with the importance of the hearings that Illinois Representative Camille Lilly, who is also the chairwoman of the women in the legislative body of Illinois, which is one of the biggest groups of a female caucus within a legislative body within the state of Illinois. And is dealing with nursing home reform, reforming the nursing home industry. And it's comprising of 4 different committees within state government, because the concerns of the seniors and the residents and the employees of the nursing home is very important, because this COVID has shined a light on the nursing home industry and how they've been able to abuse the seniors and the residents within the nursing homes and the long care facilities and the rehabilitation centers. Who the seniors and the residents and the employees, their health concerns are under the individuals that own those nursing homes. And this state, by law, has to make sure that they're doing the right things. They are in charge of individuals being able to get licensed for those nursing homes. There's laws in place if they violate it. And the Nursing Home Care Act is one of those laws that has the power of enforcement. And it ties the hands of the 102 different county state's attorneys and the Attorney General of Illinois, hands from being able to enforce the laws based on what they were elected to do. Can't happen if the Nursing Home Care Act is not enforced. And the Illinois Department Director is the one that has that responsibility to enforce it. But our governor, because his concern is the well-being of the seniors and the residents, within those nursing homes. He has a moral and ethical obligation to make sure that anyone that's a part of his administration must adhere to the functioning of that office. And these hearings that Camille Lilly and the other committee chairmen of the various committees, as well as with the support from one of the House Minority Leaders, Illinois House Minority Leaders, Representative Mary Flowers, is supporting what her vision is, or their vision is, to reform the nursing home industry within Illinois. Hopefully they can convince the governor to ask his appointed Illinois Department of Public Health Director to enforce that law. The next meeting is going to be September 22nd. Stay tuned, you're going to hear about it in the media. That's what we're going to be talking about today. And with that, I want to say to God be the glory. And Brother Omari, I can't go another step forward. Forgive me, Lord. The issues that's being presented on this show is because of the work of the producer and the director of this show that helped me find the issues and fine-tune the focus is none other than the chairman of United Peace, Inc., my wife, Terry Marsh Bradley, and technical wherewithal that help make the show flow as well as it can is none other than Brother Omari. So, Brother Omari, to God be the glory. Let's get on with the story.
If you pick up that gun and you fire that gun, anyone that get harmed from you firing that gun, that's an innocent bystander. We asking the community, ostracize them, push them out, don't let them hide anywhere, don't support them, and let law enforcement do their job.
The code is this. If you pick up that gun to solve your problem, I'm not endorsing violence. I'm saying you're violating the code if you discharge that weapon and innocent people get shot or killed, especially a child or an elderly person. And the community must uphold that code.
He got his shoe shined.
The reason that it worked in the 90s, because everyone was a part of it. Kids, women, elderly, was off limits.
You didn't touch him.
Didn't touch them.
By ostracizing from the community, pushing you out of the community, not supporting you in the community, or protecting you in the community, so that law enforcement can do their job by apprehending. And the Cook County State's Attorney can do her job by making sure that you get a fair prosecution. This is so that there's no retaliation in the community because you discharge or you fire that weapon at your intended partner.
We all got to come together. Those of you, my name is Wallace Gator Bradley. I'm the urban translator, and I'm the president of United Peace, Inc. We all got to come together to let it be known that Black lives matter everywhere. Regardless if a police shoots somebody that's black, it means twice as much to our community when someone black is shooting someone black.
With at least 8 children under the age of 10 shot in the city in just 2 weeks, Some are asking if that code still carries any weight.
This is something that we got to do.
Gator catches up with some friends on Calumet.
That 1-year-old that got killed.
His conversations of late have focused on kids getting shot. He says the rule still applies.
We as men got to put it down and say, that still exists. It never left.
We all got a responsibility.
We all got a responsibility, man.
But it never left.
I'm putting a call out to all the brothers. You know what we do. Put the word on the street that this is no longer tolerated. Me and Holmes work together and we know how it works. We've been able to help individuals turn themselves in of the community, kick them out for law enforcement to come and arrest them. Now is the time. Just like it was the video from Miss Frazier that let everybody know about the awakening of George Floyd. Somebody got a video, or we need to use our videos to stop this senseless violence.
And I believe that vengeance belongs to the Lord. And with that, I want to say, to God be the glory. And that's my story. You know, I know you're hearing it on the news, you're watching the news, you're talking to your relatives, you're talking to your neighbors, and everybody trying to find a handle to help turn the tide against this senseless violence, shootings and killings, especially of African Americans by other African Americans. Babies at home, in the house with their parents. Children getting killed. The mayor's pushing an ordinance to go after the gangs. Everybody's entitled to their opinion. Everybody plays a part of being a part of this blanket to help stop the violence. We're going to see how that going to go. It came out of the committee in the city council, approved of the conversation for the ordinance to come before the whole city council for them to vote on it. There's pro and con in that. People say it ain't going to work. A lot of the state's attorneys around the county, around the state, have said that suing gang members is not a solution to help stop the violence and bring down the crime. But I'm here today to talk about the importance of the hearings that the chairman of the Women Caucus, the Caucus of Legislative Women within Illinois, and she's also, I believe, the chairman of one of the 5 committees that came together within the legislative body to help reform the nursing home industry. So, Brother Omar, let's start with the first story, because we're going to talk about, let me see what we got up here. I'm trying to see it on the screen right over here. Yeah, trying to see which story we're going to come up with. So, okay, while we try to get that together. Ah, got it. Thank you, sir. Want to start with the Illinois Task Force, the Elder Abuse Task Force. Now go right there. Yes, sir. September 19th, a story came out in reference to the nursing home abuse. Hold on, we lost it. Anyway, it was a story that came out September the 9th, where September 19th, September 18th, I believe it is. Yeah, September 18th, 2019. The Illinois governor says enough is enough. Governor J.B. Pritzker. And it was in reference to the nursing home abuse that was happening within the nursing homes. So the governor, he launched a task force to combat high rates of elder abuse. It was in 2019. Governor J.B. Pritzker is taking action against elder abuse within Illinois. He expressed great concern over the shocking number of elder citizens that are abused in the nursing homes and by caregivers or family members every year. The governor decided that it was time to have a new approach to the problem. Pritzker announced the Elder Abuse Task Force at the Illinois State Fair in 2019. Seniors, and it was the fair's senior and scout day, okay, in August. One case of elder abuse would be too many. I got to agree with him. Pritzker said, by 20,000 cases annually is unacceptable, and I agree. I agree. That's what the governor said in 2019. Let's go to the next story, Brother Omari, I'm sorry, Brother Omari. Hit yes, yeah. This story, August 21st, 2020. I'm giving these dates to show you the importance of the task force that he put into play in September of 2019. Here, August 21st, 2020, the Illinois nursing home complaints not investigated for more than 3 months amid the pandemic that killed thousands of relatives. That's almost a year ago, which is really 2 years ago, because here we are in 2021. So from 2019 to 2020 to 2021, it's 2 years. A month after firing the state's top nursing home regulator without explanation and discipline another. I want you to hear this story. Brother Mari, could you hit that arrow right there? Yes.
Thanks for choosing to listen. We're converting your article into audio and will begin playing momentarily.
Anyway, it's a story that's explaining that two individuals, one has been fired and one was, I guess, disciplined because they didn't answer the complaints. And one of them was a deputy director of the Illinois Department
With
of Public
Sunmaid,
Health.
Whole Fruit's
Okay.
natural sweetness opens a world of
They
imaginative
do
snacks.
this.
Take a sweet or sour adventure with fruit.
Investigated for more than 3 months amid pandemic that killed thousands of residents. A month after firing the state's top nursing home regulator without explanation and disciplining another, the Illinois Department of Public Health acknowledged Friday that the agency did not investigate complaints of neglect and abuse for nearly 3.5 months during the coronavirus pandemic. In a news release, the agency said it had hired a consulting firm and a former federal prosecutor to conduct a top-to-bottom outside review of its Bureau of Long-Term Care. The Bureau oversees regulation of nursing homes and other long-term care facilities, which have been tied to more than half of Illinois' COVID-19 deaths. A health department spokeswoman said top administrators discovered July 8 that agency personnel had not investigated any of the abuse or neglect complaints it had received from mid-March until June 22 as required by state law. The most serious complaints require an investigation to begin within 24 hours, next worst within 7 days, and least serious within 30 days. The federal regulator of nursing homes, the Centers for Medicare and Medicaid, had said that during the pandemic states should focus on investigating concerns about infection control, which Illinois did continue to do, as well as serious complaints of abuse and neglect, which state officials acknowledged did not happen when it should have. Regardless, the state law requiring timely investigations of all cases remained in effect. On July 20, the agency fired Deborah Briers, an agency deputy director who ran the Office of Healthcare Regulation, and placed Amy Isham, who oversaw the Bureau of Long-Term Care, on indefinite paid leave. Isham resigned on Monday, state officials said. Agency officials did not announce these moves and, when asked about them in late July, would not say why they occurred. Officials said Friday that they wanted to focus on catching up on the inspections, figuring out what happened and deciding how to ensure it didn't happen again. IDPH now has investigated 272 allegations received during this period and substantiated the factual circumstances of 17 of those complaints, according to the agency's news release. Our top priority as a regulator of long-term care facilities in Illinois is ensuring vulnerable Illinoisans are kept safe by those responsible for their care, IDPH Director Dr. Ngozi Aziek said in the release. Anything short of that is unacceptable, and our entire department is committed to getting this right as we move forward. The lapse in investigations, the agency spokeswoman said, was based on decisions made by a retired employee who had come back to help out through June 5, in addition to Briers and Isham. Briers had been paid roughly $120,000 a year and Isham roughly $110,000, records show. Neither has responded to messages. The advocacy group AARP Illinois said the agency's delay in explaining what happened highlights broader failings by the state to prioritize Illinois' aging population. On behalf of family caregivers, the lack of transparency displayed here is unacceptable and heartbreaking for families across Illinois. We respect the investigation, but the department's failure to protect the health and safety of Illinois' most vulnerable population is inexcusable and has gone on for far too long, AARP Illinois Director Bob Gallo said in a Friday statement. In its Friday news release, IDPH said Manat Health Strategies will conduct a top-to-bottom review of the bureau that oversees long-term care facilities, with a focus on recommending best practices to ensure proper licensure and oversight activities. The agency said it also hired Courtney Cox, a former federal prosecutor, to take a closer look at specific investigations IDPH conducted into complaints made concerning long-term care facilities during the COVID-19 pandemic. This review will inform IDPH's efforts to improve existing procedures. The Tribune for weeks has been pressing the agency to release documents that could explain why, in late July, it removed Briers and Isham. On Friday, after issuing the release, the agency told the Tribune it would not release additional records, citing exemptions in state law for preliminary drafts and attorney-client correspondence. The state health department, designated by law as the state's top regulator of nursing homes, is also the state's lead agency fighting COVID-19. A Tribune investigation early in the pandemic found a high percentage of Illinois nursing homes had been cited for poor infection control practices, prompting advocates to warn that the state needed to aggressively monitor and fight the virus. Governor J.B. Pritzker and top leaders have repeatedly said their swift actions limited the virus spread and saved lives. Yet the agency's efforts have at times been broadly criticized as too timid and uncoordinated. Facilities complained they needed help getting more staff and protective gear as infections swept through hundreds of facilities. The virus has been blamed for killing more than 4,000 Illinois long-term care residents and workers, at last count. Recent federal data showed that the state's death rate for nursing home residents, at nearly 48 deaths per 1,000 people, puts Illinois among the worst third of states and territories. Public criticism of the state's oversight efforts has waned as deaths tied to long-term care facilities began dropping significantly in recent months, from nearly 500 a week in May to now fewer than 100 a week. Homes are now beginning to accept visitors again. Jamar at ChicagoTribune.com.
Now, I wanted you to hear that so that you know it's not a misinformation campaign. Okay? The dates are important. The story here is July 27th, 2020. Governor Pritzker replaces officials who oversaw the COVID-19 response in the nursing homes. You just heard the story from the August 21st, 2020, which was a month pretty much after all the evidence or the investigation came together, maybe from his task force that he had put together on the 19th, which gave them the power to give the impression that they were moving towards what I've been pushing for, which is the implementation of the Nursing Home Care Act. So that he could have his director to do the right thing by enforcing that act, immediately implementing that act. Nursing Home Care Act, Section 8. Mark, could you go to the next piece up there? The next story. Because my time, I'm about to wrap it up. Let's see. The story where it says the July 30th, 2020 resolution. Let me see. Yes, sir. Yes, sir. This resolution by the Cook County Board President and the Cook County Board Commissioners was a resolution that's known as the Save Our Seniors. Okay? This resolution was adopted on July the 30th, 2020. You just saw where the governor had the director or supported the director to get rid of the employees that weren't answering the complaints of abuse within the nursing homes during the pandemic. Okay? That was July 27th, 2020. And I want to applaud the Cook County Board President and the Cook County Commissioners for adopting this Save Our Seniors resolution. I want to say hooray, hooray, hooray. Thank you. Thank you. Thank you. That's a governmental body that was listening to the concerns of the constituents and did what all they could do. But just imagine this, if you will. Had that Nursing Home Care Act been in effect, a lot of lives might have been saved. Okay? Because the Attorney General and the Cook County State's Attorney, Kim Fox, could have went in and did a thorough investigation, possibly a civil and a criminal investigation, because of possible frauds that's been going on. But they couldn't do it because the Nursing Home Care Act wasn't implemented. It's not implemented to this day. And the date is September 20th, 2021. Brother Mike, could you put it up a little bit? I want to get past the whereas. Up a little bit more. Right there. All the whereas. It says, now and therefore be it resolved, their long-term care facilities must conduct regular universal testing for all residents and staff. Number 2, nursing homes and long-term care facilities will disclose all COVID-19 cases and deaths to residents, family members, Illinois Department of Health, and the Center for Disease Control. Number 3, nursing home staff who have tested positive for coronavirus will be given 15 days paid sick leave. Number 4, nursing home staff will be given hazard pay due to the clear and present danger of working in the facilities with limited personal protective equipment. They call it PPE. And high rates of coronavirus infections. Number 5, local, state, and federal governments will establish alternate care sites with staffing. And number 6, the state of Illinois should establish a commission to implement increased state oversight of nursing facilities, provide additional staff resources, and personal protective equipment for the workers, and consider receivership for the facilities with chronic public health violations. And be it further resolved that a suitable copy of this resolution be prepared and presented to the Illinois Governor J.B. Pritzker, Illinois Department of Public Health, Cook County Department of Public Health, Cook County Board President Tony Prattwinkle, and the Cook County Board of Commissioners, approved and adopted the 30th day of July 2020. I'm saying that because I want my listening audience to understand the power that we as a people who are registered voters have. I'm saying that because on September the 15th of this year, Camille Lilly, the chairman, and 4, maybe 5 other committees within the state legislature had a hearing that's talking about the importance of reforming the nursing home industry within Illinois. Myself, Wallace Gator Bradley, the president of United in Peace, Inc., and Miss, I want to say Loretta Brady Kidd, who is the daughter of Lottie Smith, who had died because of what was happening at Sava, Westchester Nursing Home and Rehabilitation Center in Westchester, Illinois. They didn't do what they were supposed to do for her and other patients and employees in that nursing home act. A total of 12 individuals died because of the COVID and the ineffective diseases there. The county board they adopted and approved this resolution 3 days after the filing on July 27th, under the direction of Illinois Governor J.B. Pritzker. On July 27, 2020, July 30th, 2020 is when this resolution was approved and adopted. Government working together, so everybody knew what was happening. But me and Miss Kidd, I called her Lolo, was instrumental to getting all this information to the various governmental bodies, from the governor to the legislators to the county board president to the Cook County commissioners. And here we are today, September 20th, September 20th, 2021. And the Nursing Home Care Act still hasn't been enforced. The hearing that Camille Lilly and them put together, that myself and others, especially Loretta Brady Kidd, I want to say that, the daughter of Lottie Smith, were able to testify along with another family that had a loved one that died because of what I want to say, the insubordination of the nursing homes, directors, owners, and because of the insubordination of the director of the Illinois Department of Public Health not implementing the Nursing Home Care Act against the nursing homes that weren't in compliance. But the people, me and Lottie, Smith's daughter, Loretta, thought enough for the people that's in the nursing home, the residents, and the employees to push out and reach to Camille Lilly, state representative, and a host of other representatives and state senators. And I'm glad that they had us come before that committee to share our documents and our information, to the point that State Representative Camille Lilly, with the support of a majority leader, Mary Flowers, and the other chairmen of the various committees within the state legislative body, is concerned about the well-being of the seniors and the residents and the employees of nursing homes. Camille Lilly let it be known publicly at that hearing that the concern was so strong and they're purposely focused on reforming the nursing home industry that she is going to be a sponsor to help put legislation together. And she's going to name the legislation Lottie Smith. And I'm putting the state senators on notice that they should reach out and let it be known that they would help her to push the legislation through the legislative body of senators so they can get it back to the House. Hopefully it'll pass the House, it'll pass the Senate, it'll pass the House, and then get it to the governor for him to sign that bill into law. Hopefully before June 2022. That's something that can happen, people. But one thing that can happen right now is call your state rep, call your state senators, and ask them to please let the governor know that they are in support of him being in support of his appointed director of the Illinois Department of Public Health to immediately implement that Nursing Home Care Act, Section 8, against the nursing homes that aren't in compliance, especially with this new variant of COVID that's happening, that's sweeping the country, that's sweeping Illinois. The governor, in my opinion, and my belief, is sincere about doing everything that he can for the public safety, for the health and the well-being of the residents of Illinois. I'm in support of the mandates by him being the leader of the state that he's pushing and making. Because there's just certain things. When I was a member of a street organization, and we was going through a level to try to make our community safer, we had to change our ways. We had to ask for redemption from the community to allow us to be a part of their plan in the name of public safety. And there was people that didn't want to do what was right. Like we seeing now, there's people that don't want to push the vaccine, that don't want to wear the mask. Well, back then, there was people that didn't want to go from a negative to a positive. Many are called, few are chosen. But there's a group of people that become the we instead of the me, that are willing to do the work for the betterment of the whole, inclusive of those who didn't feel that the work that we do, like the work that the governor and everyone else, the mayors or whomever, they're saying, please get vaccinated. So those that's not getting vaccinated, that's their opinion not to get vaccinated. But when I was in the street organization, we called those who don't want to put in the work. We got to consider them too. We call them the ungrateful. Governor, do what you got to do with the power of your office to do, inclusive of taking upon yourself to enforce that Nursing Home Care Act, Section 8, against those nursing homes that aren't in compliance, if the director don't want to do it. And with that, let me wrap this up. I want to say, I thank all like-minded people. I pray that the legislators come together to help reform the nursing home industry and support Chairman Camille Lilly's legislative piece. I don't know what number they're going to give the bills. I just want to say it's going to be in the name of Lottie Smith, so the governor can sign that bill before June 2022. I want to say, hey, stay prayed up, get vaccinated, wear your mask. And I want to say, as I wrap this up, I want to say to God be the glory. That's my story. And I thank you for listening, looking and listening.